If you or someone you know has been diagnosed with benign prostatic hyperplasia, or if you suspect that you have it, this video is for you. Even if you don't have it yet and you are a man in your 50s, 60s, 70s, or are closely approaching it, keep watching. In today's video, we will dive deep into benign prostatic hyperplasia, or as we are going to be referring to it going forward, BPH. We will start by discussing what BPH is, then we will go into the symptom checker. We will also be looking at the possible medical tests your doctor will have you go through in order to confirm that you have BPH. Then, we will also touch on some of the more conventional medical treatments for the condition. We will also be briefly touching on some home remedies and lifestyle changes you can do in order to help alleviate symptoms. If all of this sounds interesting to you, please like this video and consider subscribing to our channel and hit the notification bell so you get notified whenever we post something new. Your Wellness Journal is a channel run by nurses. We aim to provide informative health videos from the perspective of medical professionals who have been trained to care for you. Now, let's get on with our video on benign prostatic hyperplasia and start our discussion by answering the most basic question. What is BPH? Benign prostatic hyperplasia is a very common condition that affects the prostate gland in men as they get older. The prostate is a small gland located below the bladder that helps make semen. In BPH, the prostate gets bigger and can start to cause problems with urination. BPH is not cancerous, but it's still important to get checked out by your doctor if you have symptoms. According to the Mayo Clinic, BPH affects almost all men as they age, with about 50% showing signs and symptoms by age 60 and 90% by age 85. So, what exactly happens in BPH? As the prostate enlarges, it can start to press on and block the urethra, which is a tube that carries urine out of the body. If left untreated, BPH can sometimes lead to complications like urinary tract infections, bladder stones, and kidney damage. However, these complications are rare, and for most men, BPH is more of a nuisance than a serious health threat. Doctors aren't totally sure what causes the prostate to enlarge, but it seems to be related to hormonal changes that occur with aging. The important thing is not to ignore possible BPH symptoms. If you're having any problems with your urination, don't hesitate to bring it up with your doctor. Together, you can find the best approach to manage your BPH and improve your quality of life. Now, speaking of symptoms, let's take a few minutes and discuss them. When it comes to BPH, there are key symptoms to watch out for. As your prostate gland gets bigger, it can start to press on your urethra, which is the tube that carries urine out of your body. This can lead to some bothersome urinary symptoms. Some of the most common symptoms include difficulty starting to urinate, a weak or interrupted urine stream, frequent urination, especially at night, feeling like you can't fully empty your bladder, and sudden urges to urinate. One of the most common signs is difficulty starting to pee. You might feel like you really have to go, but when you try, it takes a while for urine to come out. Some men also notice a weak or interrupted urine stream, like it stops and starts several times. You might feel like you have to strain or push to fully empty your bladder. Another symptom is feeling a sudden, strong urge to pee. This is called urinary urgency. You might also find yourself needing to go to the bathroom more often during the day and even multiple times at night. This frequent urination can be disruptive to your daily life and sleep. According to the Mayo Clinic, other possible symptoms include dribbling at the end of urination and a sensation that your bladder isn't completely empty after you go. It's important to note that these symptoms can come on gradually. A study published in 2018 found that lower urinary tract symptoms related to BPH often progress slowly over time. If you're experiencing any of these symptoms, don't brush them off as a normal part of aging. While BPH is common in older men, it's not something you have to live with. There are many effective treatment options available. Before we talk about treatments, let's first do a quick run-through of how is BPH diagnosed. When it comes to diagnosing BPH, there are a few steps your doctor will likely take. First, they'll probably ask you about your symptoms and do a physical exam, including a digital rectal exam. This involves your doctor inserting a gloved, lubricated finger into your rectum to feel the size and shape of your prostate. Your doctor may also recommend a few tests to help confirm the diagnosis and rule out other conditions. One common test is a urine flow study, which helps measure how strong your urine stream is and how much urine you actually pass. A reduced urine flow can be a sign of BPH. Another test you might have is a prostate-specific antigen or PSA blood test. PSA is a protein made by the prostate, and elevated levels can sometimes indicate BPH and maybe even prostate cancer. In some cases, your doctor may suggest a cystoscopy. This involves inserting a thin tube with a tiny camera into your urethra to get a closer look at your prostate and bladder. Imaging tests like a transrectal ultrasound or MRI might also be used to measure the size of your prostate and check for any abnormalities. Now that we have the diagnostic tests out of the way, let's talk about treatments. When it comes to treating BPH, there are several options available depending on the severity of your symptoms and how much they're impacting your daily life. If your symptoms are mild, your doctor may recommend what's called watchful waiting. This means making some lifestyle changes and having regular checkups to keep an eye on your symptoms. Some of these lifestyle changes can include reducing the amount of liquid you drink, especially before bedtime or going out, cutting back on caffeine and alcohol, and doing exercises to strengthen your pelvic floor muscles. If your symptoms are more bothersome, medications are often the next step. There are a few different types, but the most common ones are alpha blockers and 5-alpha reductase inhibitors. Alpha blockers relax the muscles around your prostate and bladder neck, making it easier to pee. 5-alpha reductase inhibitors actually shrink the size of the prostate over time. For more severe cases, minimally invasive procedures or surgery might be recommended. According to the American Urological Association, a transurethral resection of the prostate is still considered the gold standard surgical treatment for BPH. A TURP involves removing the excess prostate tissue that's blocking the urethra. Newer, less invasive options are also available, such as a prostatic urethral lift and water vapor therapy. A 2018 study published in the Journal of Endourology found that both of these minimally invasive procedures can significantly improve BPH symptoms with fewer side effects compared to TURP. There may also be some home remedies you want to try. These include eating foods rich in lycopene and avoiding stress. You can also benefit from getting more zinc. So, when should you see a doctor? If you have not been diagnosed with BPH yet, but you suspect you have it, we recommend seeing a doctor right away if you are exhibiting any of the symptoms we discussed. BPH can be uncomfortable, and there is no need for you to live in discomfort when your healthcare provider can do something about it. If you have already been diagnosed with BPH and are in the watchful waiting stage, be sure to see your doctor if any of the symptoms you have been experiencing worsens. We'd love to hear from you. If there's anything specific about BPH you would like us to discuss, let us know in the comment section below. The same goes if you have an effective home remedy for BPH and would like to share it with us. We would value your input and would be a great place for the Wellness Journal community to learn from. If you'd like to watch more of our videos, check out the playlist on your screens now. We are your Wellness Journal. Have a healthy day.